All right, let's jump into some segments. So I always, find topics to talk about based on news articles that I see. And this first topic comes from a news article that was about a research paper that came out a little bit earlier this year. It's not brand new, but it's within the past few months. And this is about plastic surgery and chronic pain. And the study comes out of Norway. And the study looked at a lot of different metrics, but one of the biggest metrics they were looking at is, okay, you had cosmetic surgery, and do you still have pain? Mm-hmm. And the study found that 1 out of 8 patients still had pain at 3 months.
Yeah.
And so did I put a slide in that's the article title? 12? Yeah. No, that's the next one. That's the next one. Never mind. I thought I had another pick. There's not another one to this segment? I thought there was 2.
I didn't see one.
Okay. I must have just forgot to upload it. Anyway, all right, so the article basically frames this whole study as 1 in 8 plastic surgery patients have chronic pain, which I just, I see things like that, and I want to make sure that people know what that means, and it's not, to me, that has a very negative connotation.
Yeah.
Well, I mean, if I saw an article title that said, 1 out of 8 people that does X has chronic pain, I'd be like, well, X kind of sucks. I mean, that's a pretty high number.
Yeah.
And so I want to kind of break that down as to, is this a big thing or is it not? And so like the first question I would ask is, would it be unusual for a patient who had a plastic surgery to still have some amount of pain at 3 months? And my answer would be, I mean, it wouldn't be common, but I wouldn't say it's super rare either. Mm-hmm. But it just depends on a lot of different factors. And the factors that I would look at is, what are they quantifying as pain? Like, does that mean that if I reach down and pick up something heavy that I feel a twinge where I had my surgery? Is that post-op pain? I mean, you could have that for months and months, but does that mean you have chronic pain? Well, it just kind of depends on what your definition of chronic pain is. To me, when I think of somebody with chronic pain, I think of something that's really bothering someone.
Yeah, I think of somebody just like sitting there doing nothing and it's hurting them.
Yeah, right. Or it's enough of a hindrance that is affecting their daily life.
Yeah, well, they have to take Advil every day or something.
Yeah. So I think that, defining exactly what that means is important. I'd also ask, what surgery did they have? I mean, and I'm going to break this down for you because where I'm going to kind of go with this segment is I'm going to talk about some of the most popular plastic surgeries and what my thoughts are on like what the pain level would be and if chronic pain would be a concern. Mm-hmm. So I think what surgery, is important. And then of course the patient. I mean, every patient's different. I've done the same operation on 2 different people, and I would have one person tell me that the pain was a 1 out of 10 and somebody tell me it was 11 out of 10.
Yeah.
And it's the same operation. And so there is a little bit of subjectiveness to it. So as I said, I wanted to kind of break this down into surgeries as far as what do I think pain levels are for plastic surgery. Now, of course, non-plastic surgeries, I mean, they tend to be more painful because a lot of plastic surgery is operating on skin and fat. When you operate on skin and fat, the pain levels are generally pretty low. Mm-hmm. When you're doing orthopedic surgery operating on bone, that tends to have a much higher pain level. I had 2 knee surgeries, and man, the first one I had was pretty intense. Like I was on crutches for a month because it hurt so bad I couldn't even walk. Yeah. Unfortunately, plastic surgery is not like that. So I broke these down into some different categories, and of course, I didn't include every plastic surgery, but I just kind of hit the highlights. Yeah. So ones I'd put in the easy category. So in the easy category, I would put first off breast implant exchanges. Super popular surgery. Last week we talked about the most popular plastic surgeries. Implant-based surgeries is number 1, although that does group in augmentation and implant exchanges. There's a lot of implant exchanges that happen. If you have breast implants and you go to get them swapped out, your pain level is going to be minimal to none. Yeah. It's going to be very, very low. All the hard work's done. The pocket's there. You don't have to do a whole lot. One that I include in low pain is eyelid surgery. It's a very, very superficial surgery for the most part. Now, if people have different aspects, like say, for example, they have a very lax lid and you have to do a canthopexy, there's a little bit more pain associated with it. In general, eyelid surgery is pretty easy. I will put a footnote to that. The biggest kind of complaint with people with eyelid surgery is not pain, but swelling.
Okay. Does eyelid surgery include the top and the bottom?
It includes whatever you want to do.
But it's like either or both.
When I do eyelids, I probably do 20 uppers for every lower. Uppers are much, much more popular. And I like doing uppers better because overall, I mean, it's easier, you know? I mean, to me, upper eyelids are one of the simplest things I do. I mean, you have to know what you're doing, and you need to have done a certain number, but once you kind of get the hang of it, upper eyelids are pretty simple, I think. I mean, I've done tons of them, and I don't think I've ever reoperated on an upper eyelid patient ever. But in general, the pain's not too high. Also in the pretty easy category, these are getting a little bit more intense, but still pretty easy. Breast augmentation, breast lift, breast reduction.
Yeah.
All the breast surgeries are pretty easy. I know we've talked about you've had breast surgery before, so
Yes.
I'm not putting you on the spot. What did you think when you had breast surgery? Was it easy, hard, medium?
Well, my mom took care of me after I had it, so that was nice for like the first like day.
Yeah.
Yeah.
But would you think it was like pretty intense surgery overall, or not too bad?
No,
Yeah.
I didn't. Nothing really, in terms of like long term, nothing really affected me. But I will say that like I lost some feeling like at the beneath right here.
Sure. Yeah, that's not uncommon at all.
Below that.
Yeah, sensory
Nipple
changes.
line.
Yeah, sensory changes is one of the biggest risks. Well, I mean, really with any surgery, but definitely with breast augmentation
Yeah, that's
surgery.
the only thing that
Yeah.
I ever noticed from it. Besides that, it's
Yeah.
great.
If I was going to rank breast surgery, so breast aug, breast lift, breast reduction, I put all those in the same category, honestly. I mean, if I was going to rank them on a 1 to 10, with 10 being the worst pain surgery and 1 being zero pain, I'd say it's probably a 3.
I mean, there's a reason why it's like the top surgery.
Exactly right. Yeah, you're
It's
100%
like,
right.
If there's the risk and
Yeah.
the reward,
Right.
outweigh each other, then it's not gonna happen.
Agree. All right, I'm going to move on to some of the moderate recoveries here. I would put liposuction in the moderate recovery. You know, if you get liposuction, you're going to be a little sore. It is just sucking out
kinda
fat,
like
but
beating
generally,
you up.
Huh?
Kind of like beats you up a little bit. You can
It
get
does.
bruises and stuff from it, right?
That plus when you're sucking the fat, you're generally sucking the fat layer that's up against the muscle layer, and you're coming at it from the bottom up, and so you will bang up the muscles a little bit, and so there is some soreness associated with that. I put arm lift and thigh lift in this medium category. You are just operating on skin and fat when you're doing arm lifts and thigh lifts, but because it's your arms and your legs, you use them all the time, and that makes it seem like they're more sore because you're using the area
Yeah,
that has
that
been
makes
operated
sense.
on. Yeah. The other one I put in the medium category was nose jobs. Now, nose jobs can mean a lot of things. Like some nose jobs or rhinoplasties are very, very simple, and it's going to be very minimal pain, and some are super complex that actually you'll have a lot of pain. Like for example, if they're breaking bones, like that's going to be more painful than if they're just like shaving cartilage. But in general, I threw them in the medium category. Like generally they're not terrible, but they're not super easy either. So higher level. I put facelift and neck lift in here. I think it's more towards the bottom of the more intense category. Like I don't think it's the worst. You know, the thing about the face is that, you know, it's lots of sensory nerves. When you operate on it, it can be sore. There's a lot of swelling, which can
to
cause you
me,
pain.
whenever I see like pictures of people like after, like right after, it looks like the most like
You can swell so
serious.
much from like a facelift and neck lift.
it looks like the most scary thing to do.
I tell my patients, I do some facelifts. You know, I specialize in breast and body, but I've kept up my skills in facelift and neck lift, so I still do them. I tell my patients that be prepared to not recognize yourself like on post-op day 1 or 2. Like you could swell enough that you're not going to recognize yourself in the mirror.
And you're going to be like, what did I do to myself?
And you can be totally fine with that. I mean, your face can swell a lot and you should be totally fine. The next one I put in here is BBL. Brazilian butt lift is a combination of liposuction and fat injecting. The reason I threw this one in the little bit more intense category is because when you're getting a BBL, generally they have to pull fat from a ton of different places. So it's like you're getting liposuction all over, and then they're injecting it back in, and then you're gonna have pain in your butt, which is hard because you're, you know, when you're sitting, and then all of the donor areas. So I think that, I don't do BBLs, but just based on what people told me, I think that's definitely a little bit more intense.
Yeah.
And then the big one, which I do the surgery literally all the time, I bet you know what it is.
Mommy makeovers.
Tummy tucks, yeah.
Tummy tucks. Yeah.
So the reason tummy tucks is always going to be in the top category for post-op pain is due to the repair of the muscles of the abdomen.
Yeah.
You know, when you tighten those muscles of the abdomen, which are core body muscles, right? So I'm using my core body muscles while I sit in this chair. It's keeping me from tipping over. I use them when you're walking. I mean, you're literally using your core body muscles anytime you're not laying flat. If you operate on those, and what I mean by operate is you're suturing them together to tighten them up, and then you're using them all the time, you're gonna have pain.
Yeah.
And so I tell all my tummy tuck patients that you need to expect that you're gonna be pretty sore for at least a week, if not 2, to
Yeah.
where you don't necessarily want to go to work and stuff. So, and also too, we haven't really been talking about, could you have chronic pain from this, which was one of the things we're talking about. I think of all the surgeries, the risk for having chronic pain would probably be the most for tummy tuck. That's a really big suture that tightens up those abdominal muscles, and your muscles can be unhappy for months.
Yeah.
Now, realistically, what's the normal expectation? I mean, with my patients with tummy tuck, generally by a month they're going to say that they don't have pain.
Okay.
But versus like breast augmentation, would be in 2 days.
Yeah.
On average. So I think that chronic pain, and like I hate to say chronic pain, because to me chronic pain is something that doesn't necessarily go away.
That's what I think of.
Yeah, right. I mean, when I think of chronic pain, which is why I just took issue with the way that this article was stated.
You think like chronic migraine, like something,
Yeah,
like you
something
wake
that-
up every morning with
Yeah,
a
something
migraine.
that doesn't go away.
Yeah.
If you're having pain from plastic surgery 6 months or a year down the road, there's something wrong.
Yeah, they forgot something in there.
Yeah, like where's my car keys?
Yeah.
No, I mean, but you could have something like internal, like the classic one would be when people get contracture of a breast implant and they have pain from that, and it doesn't
Yeah.
go away because there's a problem. There's something
Yeah.
wrong. Or say you have a tummy tuck and you have a bleed and the surgeon doesn't notice it, and you have this big hematoma in your abdomen.
Yeah.
That's going to cause you pain long term. I mean, if you have pain, past 3 months with plastic surgery,
You should be
need
going back to the
Yeah, you
doctor.
need to go back to your doctor and be like, hey, I'm having pain. Is this normal?
Yeah.
And so, and along those lines, the last thing I wanted to discuss is, what can cause long-term pain from plastic surgery? Complications. I mean, that's got to be number one. I mean, if something goes wrong and it's not addressed properly, or even if it is addressed properly, it can drag out your recovery time and you can have pain for longer periods. Another thing is if you're having too many surgeries at once. I mean, if you're having like 4 or 5 surgeries, which I am totally against, I've talked
Yeah.
about that many times, that your complication rate absolutely goes up the more surgeries that you add.
Yeah, your body like can't handle that.
Yeah, right. And like you're gonna be recovering worse when you have multiple areas
And
that are
slower.
painful. Yeah, because think about this. If you go have surgery on one area, you're gonna baby that area. You're not gonna use it as much. But when you have surgery on multiple areas, it's harder to baby one area because your other areas can't compensate.
Yeah.
So having too many surgeries. Then major surgeries, once again, I said things like, tummy tuck, which I consider is pretty major, more likely to cause long-term pain. And then the last one would be is if people don't give themselves enough time to recoup, meaning
Yeah.
they're too active.
Yeah.
I've had people that at 4 weeks are still swollen. I'm like, okay, well, what are you doing? It's like, oh, well, I'm back to my regular routine. I'm like mowing the lawn. I'm like, working in the garage. I'm like, oh, no wonder you're still having pain. No wonder you're still swollen. You didn't give yourself enough time to recoup. Let your body heal. Let yourself get back to normal before you jump back into doing heavy stuff.
Yeah.
So I don't know. I like to talk about that article because once again, when I saw how it was written, the article, not the research paper, it really kind of, to me, was not. It was kind of misleading.
Yeah.
It wasn't exactly how I would describe this, and I just want to make sure people are educated.
Yeah.
Like it's not fair to say that 1 out of 8 people have chronic pain after plastic surgery. Technically, it could be true depending on how you define it.
It should be pain for a month or 2.
Yeah, but I mean, to me, chronic pain means that there's something wrong.
Yeah.
I don't think 1 out of 8 people have something truly wrong. Do they have some soreness? Maybe. I'm off my soapbox now.
Okay.
Let's move.